Hello everyone, my name is Akansh Shrinani and welcome to my YouTube channel, Neuro Chat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism, late autism diagnosis, and autism in women and girls. I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists and seek their views and updates on their latest work and research. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. Lastly, keeping inclusivity as a topmost priority, we might also discuss controversial disparate views for a collective understanding of issues and respect for diverse views. All the views and topics discussed are for informational purposes only. If you are interested in watching more quality content on this topic, please hit the subscribe button. Don't forget to press the bell icon to be notified whenever a new video is uploaded. Please also share the channel with your friends, family, and social media platforms. Thank you. Dr. Rebecca Landa is a distinguished professor in the Department of Psychiatry and Behavioral Sciences at the Johns Hopkins School of Medicine. She is widely recognized for her research on autism and early intervention strategies. As the founding director of the Center for Autism Services, Science and Innovation at the Kennedy Krieger Institute, Dr. Landa has dedicated her career to understanding autism and enhancing the lives of individuals and families affected by autism. Her work emphasizes the critical role of early diagnosis and intervention, and she has made significant contributions to both clinical practice and academic research. Additionally, Dr. Landa is committed to training professionals and raising public awareness about autism. Dr. Landa, welcome and thank you very much for the time today.
Thank you for inviting me.
And to jump right into it, what inspired you to pursue a career in developmental psychology, particularly focusing on autism?
Sure. When I was a kid, it used to make me wonder, why were there certain kids that other kids bullied and made fun of? And that was heartbreaking for me. And I made up my mind that when I grew up, I was going to do everything I could to help kids be all they could be. When I got into college, I discovered the field of speech language pathology. And so I went to work after I graduated in a public school setting. And I began to wonder, gosh, am I doing really everything I can for the kids? And then there were certain kids who really had a tough time learning. And I didn't really fully understand autism then, but I came to understand that it was autism, but nobody really knew the best way to help autistic kids learn. So I went back and got my PhD and studied brain sciences and communication sciences and developmental science. And then I did my postdoctoral fellowship in psychiatric genetics. And that's where I really learned that autism was heritable. And it's not just autism that's heritable, but this other array of various kinds of challenges. And so I think I've really dedicated my career to understanding how autistic people learn, how autism develops, and then developing the best interventions.
Thank you so much. And how has the Center for Autism and Related Disorders evolved since its founding? And what do you consider some amazing achievements?
Well, I opened that center to be an integrated, multidisciplinary center where families could come and there would be experts in as many aspects as there could be for them to be able to get holistic care for their child. And we started off with one full-time person and a couple part-time people and 2 offices. And now we have 4 sites, see about 7,000 different patients a year, have about 270 staff. And so I think some of the biggest changes are how much more diverse we are, and the levels of care that we're able to give, but also this achievements program, this early intervention program that I developed that maybe we'll talk about later, but also our informatics database that we have that has tens of thousands of patients so that we can easily study complex clinical matters, but also being able to look at autism from causes all the way to mental health, to physical health, to community implementation of these evidence-based practices. That's how it's changed.
Like you just mentioned, the early achievements intervention model. So, what is that? How has it developed? And like, what makes it so effective?
Well, when I started it many years ago, there were two primary intervention approaches for young children. One was called LOVAS therapy or discrete trial training, and the other was floor times, Danny Greenspan and Serena Weider's approach. And from my training in neurosciences, I just knew the brain just doesn't learn in an either or way. And so I developed this intervention that really brought in the depth of findings from the developmental sciences, like, for example, embodied cognition. That is giving children physical experiences as they're learning language, and also these principles of child initiation rather than kids being passive learners during instruction. I also wanted kids to be able to be ready for school. And so doing one-to-one intervention in a therapy room just it doesn't pull for generalization. It doesn't get kids ready to go into classrooms. It doesn't help them build friendships. So this classroom-based model that is a multimodal, multisensory experience for kids where it's designed to hit kids at their developmental level and to expand their skills and in playful, fun ways that make sense to them, motivate them.
Thank you for explaining that. Um, and especially regarding that early autism diagnosis and, basically what would result in that achievements model being used. Um, what do you consider the like reliable markers of autism in infants and toddlers? And are there any promising biomarkers or diagnostic tools under investigation that you believe could kind of revolutionize this space?
Sure, that's a lot of big questions there. With regard to, we do not have an autism-specific behavioral marker or a biological marker right now for autism during infancy. I will tell you that the two areas where uh, there are signals that there will later be a social or communication delay, not 100% sure, but that kids could go in that direction are motor delays and differences in visual attention. And so, there should be screening of all infant siblings of autistic children looking at these aspects of their development. As babies go through their development and get into the close to the first birthday, then we start to be able to pick up more signals that we can keep a very close eye on or even start intervention. And so during in that second and third year of life is when autism symptoms or signs begin to come together in a way that's diagnosable. And we call that symptom or sign consolidation. So autism has that silent period during infancy where we don't have a specific marker per se, but we do have flags that we can test for and monitor, and parents can do in their own home too. As far as biomarkers, one of a potentially promising biomarker, it's called Strand DX, and it's by Manish Arora at Mount Sinai. And so he takes strands of hair and he's able to look at them in like kind of chronological layers, almost like inside the trunk of a tree, you have those rings. And he's able to look at something called the exposome. So things that the child might have been exposed to or different biochemical differences in the child. So all he needs are a few strands of hair, and he has FDA approval to be able to test this out in children with and without autism. Very promising. Some other promising techniques involve eye tracking that can be done on a cell phone or on a tablet. And again, those really are, I'm not sure that you would call them biomarkers as much as screeners, and that they become more useful in the second year of life, sometime around 16, 18 months. So it's just another tool in the toolbox for screening kids rapidly.
Are there any advancements in neurodevelopmental research that have influenced that have influenced your understanding of autism, or that you kind of are excited for, and are shaping or will shape your work?
Yes. So I would say that in the neurodevelopmental sciences, insights into how different brain regions affect each other and knowing that brain development is so influenced by experience are really critically important for my research. For example, there's evidence that frontal brain regions can buffer the impact of other brain regions, like more posterior regions where motor system might be affected, such that these things could impair a child's developing imitation and social synchrony and communication and play. But if we start to work with young children on social interaction and social engagement and communication, all these things, we can actually strengthen the stronger brain areas and help children compensate or have other strategies to use, or help the brain adapt in a way that's more supportive of the child being able to have success and independence. So there's also been advances in understanding the motor system and how that relates to language learning, and also how we can use technology such as markerless motion detection or computer vision, which is some of the stuff we're doing in our lab right now, to understand more about movement and how it relates to language learning.
Yeah, thank you so much for explaining that. And what is the significance of longitudinal studies in autism research? And what insights have you gained from tracking individuals over time that you couldn't have otherwise?
Well, first of all, development is not a linear thing. So sometimes we might think that, like when you plant a seed, there's very, it's kind of linear, right? The sprout comes out of the ground and it grows up and then it gets leaves. But what happens with child development or infant development, it kind of ebbs and flows. So a lot of times it'll look like there's a period where the child or the infant is stalled, like there doesn't seem to be that much coming along. But what's happening during those periods is that there's lots of other sort of infrastructure learning that's going on in the brain. And then when the skill development occurs at the next more complex level, it's very different than where the child was before. It's much more complex. So even imitation, so like babies can imitate very close to birth, but then the imitation they do at 6 months, it has different neurological underpinnings. So and it's much more powerful and useful to children. So longitudinal research lets you define what's happening along the way, even during these periods of development where it doesn't look like that much is happening on the outside. You can use experimental tasks to really see what babies are learning through their gaze, for example. And then the other thing that longitudinal work lets you do is to begin to see when these indicators of autism or communication delay begin to appear and how they appear. The other thing is that you're able to see like the losses, like in autism, as I mentioned before, there's a silent period autism that we call the prodrome. And then in the second year of life, we may see a decline in skills or a decrease in frequency of looking at people and smiling, for example. And this helps us map on the timing of these things and start to make inferences about how they relate to the brain. And the other thing that all of this does that's so high impact and important is that it helps you understand how to design treatments and to know when to do what in your intervention.
Do you think that cultural factors influence the perception and treatment of autism? And what challenges have you encountered when addressing these differences in your research?
There's so many. I'll just explain some of them. One of the things that can happen, at least for families that are living in the US, if they speak one language, but their child is learning to understand and speak English, the parents may not notice some of the social communication differences in their child. This can delay diagnosis or the child coming to professional attention if there is a delay or autism. Also, in some countries or areas of countries, there can be limited scientific and clinical literacy, such that parents might not really know what to look for in these early signs. And then in some cultures, toddlers are still considered babies. And so parents might be more willing to wait out delays than maybe the mainstream American cultures are willing to do. Also, in some families, like Latinx families, for example, a child who's showing preference for sameness or arranging things or behavioral rigidity may be perceived as a strength. These things may be perceived as a strength because in some homes where children are, the home is very clean, for example. It's a cultural value to have tidiness in the house, and if it plays right along with the child's behaviors, as I say, this could be a strength. And then in some cultures, there's coming upon the autism diagnosis is particularly hard because families have gone through so many hardships in their own lives. And they just had this dream that their child wouldn't have to experience such hardships. And so these are just some examples. So many of these things can cause doubt in the scientific literature or maybe lack of willingness or readiness to hear a diagnosis. Also, there can be some stigma in families where if the diagnosis happens that there can be some separation in the family, even discord in the marriage. So when we run into these things clinically, I mean, the most important thing for us is to be culturally literate and be able to meet families where they are and to really try to understand their perspectives and help them be as equipped as they can be for what their priorities are for their child, and then to be there for them across this journey.
Yeah, thank you. And I'm sure that makes things a lot harder. So are you able to, and if you are, how or what do you do to kind of address those challenges?
Well, the very first thing you have to do is understand what does the family want for their child, and then during the assessment, for example, to talk about the specific behaviors that are happening and help families have a word for it. I've developed a video guided screener that is narrated. So there are these very brief videos of children with and without autism or developmental language disorder. They're 1 and 2-year-olds, and parents watch these videos and then they answer questions about their child's development. And so right now we're in the midst of a psychometric evaluation of this. But what parents tell us over and over again is how clarifying these videos are and how it gave them words for understanding the various behaviors their children has. And a lot of times when you start to understand these behaviors, they become less mystifying and helps parents build a bridge with their child to build a stronger relationship. And then some of the fear starts to fade.
Thank you so much. And in doing your research, when you're kind of looking through or doing a study, kind of what methods and methodologies do you find most effective in your research? So, and how do you make sure that, the results you're getting are valid and reliable?
We come at that from a number of ways. One way is to really vet our methods carefully before we start using them in our research. So that's called piloting things. So when you're designing a new measure, you need to run it on a lot of participants so that you can see if it's performing as intended. The activities that we give kids in order to motivate them have to be fun for kids. And it has to be something that children can do something with it, right? So there's some of the things that we use are more tech-based, like, for example, using eye tracking with really interesting visual scenes. Another thing that we do, as I said before, is to use the computer vision And in that, kids don't have to do a whole lot other than play fun things. Other things that we do look at learning. So we put children in situations where they have to figure out how to make something happen, for example. And so I think it's the other thing that we do is that we'll give like three measures maybe that we think target the same skill or information processing. And that way we can cross-check across these and see if we're getting reliable indicators.
Are there any gaps in the current research going on that you find pressing, and how do you plan on addressing them in the future?
Right. Well, I can tell you that one of the big areas that I am concerned about is how we know when our interventions need to take a different route. So I'm very keen to understand like what measurements we should be doing during treatment and how do we know when we want to ramp up the intensity, when we need to add in other ingredients or change our methods completely. So that would be like personalized care, right? Another thing is for minimally speaking individuals. I want to understand more. There's a gap in the field there in terms of really understanding the diversity. They're not just one learning challenge that is interfering with learning to communicate. And not that communication has to be verbal or spoken. It can take many different kinds of forms, but we want to be able to help autistic individuals be as successful in their communication. Autistic people want to communicate. They just need a way to get their ideas out. And so we need better understanding of that and how to help and design appropriate interventions. Another thing has to do with how can we expedite the transfer of research knowledge to implementation in public schools. That's another important line of research. And then finally, another big thing that's high on my list, not that these are all the gaps by any means, but another big gap is understanding high support needs autistic individuals and seeing if we can prevent some of them from getting into states of significant aggression and self-injury.
Those are a lot of big issues. One thing I'm really curious about, especially in that first one, because this is like the first time I'm hearing of it, but I'm sure it's like, I can understand how that could be a problem. But like, for example, like you did with your early achievements intervention model, like, I mean, you kind of saw a gap in terms of like what the current interventions were doing, and you kind of addressed that. So, um, how much, and I'm sure this is a lot, but like how, like when do you think like the last, like kind of shifts were in like autism research and like how we look at it? And what do you think, like, if you had to guess, what do you think the next one's gonna be?
Well, here's the thing. The discoveries that impact at least my thinking in autism don't just come from the autism field. For me, it's important to be in multiple literatures at the same time and trying to apply the advances in other fields to the field of autism. And so these breakthroughs are happening all the time. And for researchers, we keep pretty busy uh, trying to design the next study that can hasten discovery. So what are some of the big breakthroughs? And when do I think the next one's coming? I think the breakthroughs in technology have been extremely beneficial. And it takes a long time to take these, let's just say computer vision. Like computer vision has its own limitations. Like, so for example, if there's a video that has three people in it, and you're trying to isolate to get the computer vision to isolate the person that you want or the part of the body that you're interested in. This is not super easy. It's not super easy. So it takes a while to transfer these technologies into things that can actually be made clinically viable. Uh, so um, I think some of the big breakthroughs too have been understanding the different trajectories of autism development so that we can help pediatricians and parents stay on top of not just screening at one age, but if a child passes screening, test again. Um, Again, I think some of the eye tracking work has been very helpful to understand the attention system in autism. And then one of my colleagues, Dr. Rachel Reetsky, is working with ERPs and auditory processing to try to understand what it is in speech and language that's breaking down for some autistic children at different stages in their development. So,
Yeah, thank you. To kind of go back to another thing that you said a while ago in your early interventions model and like early diagnosis in general. So why do you believe that early diagnosis and intervention are so critical for children with autism? And like what are the benefits of it and what are some of the most effective strategies you've encountered?
well, the brain is the most malleable or the most changeable by experience during early life. We remain learning our entire lives, but it's during the first years of life when children's experiences have the greatest impact on how the brain wires itself and how different brain regions connect to each other and what pathways get laid down with the greatest um, degree of robustness, I guess. And so, it's critical for our children's experiences in early learning to be optimized. And so that's why I'm passionate about detecting delays or elevated likelihood for delays early in life to give parents strategies that they can use at home to interact with their child that will enrich the child's brain development even before diagnosis. So the other thing that can happen, and it does happen, is that when a child is developing and showing signs of either atypical development or not being developing certain milestones on time, parents will adapt to that child's behavior and the child adapts to the parent's behavior. So there's this bidirectional influence back and forth that can sometimes result in kids' development getting in a rut and even the parents getting in a rut with expectations from the child and the child's expectations of the parent. And so we want to make sure that that cycle of caregiver-child interaction continues to get richer and richer and richer and building children's ability to construct meaning from their experiences and being able to convey what's in their own minds to other people in a way that elicits from other people the richest possible input. And so you asked about what strategies are really effective. I'd like to start with a please don't do. So I like for parents to avoid giving kids cell phones when they're infants or toddlers. It's not good for their brains. What kids need, and the literature is so clear about this, they need human interaction. And what they need from you is for you to talk to them about what they're doing and about what you're doing. And you don't need to buy expensive toys for kids. A 99-cent ball is probably the best toy you can give a child because it's something that you can do many things with and that can have turn taking back and forth and that you can say many things about such that you're building nouns and verbs and adjectives, and that enables children to develop understanding of phrases and sentences and produce them too, and to build anticipation. So if you're getting ready to throw a ball or roll a ball to a child, they start to be able to read your signals. So to me, some of the most powerful, not just to me, what the literature says and what we've learned through our research is that these things that parents can do at home by following their child's attentional lead, playing with children at their developmental play level, expanding these play routines with children, talking about what kids are doing and give them the words for what matters most.
Regarding what you just said, like not getting in a rut and, you know, making sure you're building, um, like, could you give an example of kind of like what that looks like, what getting into a rut looks like and what, the goal should be to try and build off of, yeah.
So sometimes when children play, they play in a repetitive way. And so let's just say they're lining up blocks. And there's so many other things that parents think that their child should be doing with these toys. But maybe parents start to believe that that's what their child can do. And so they don't expect their child to do more. And maybe when their child is lining up blocks, this is just an example, okay? There's not a lot, maybe there's not that much for them to talk about. What are they going to say? Block, 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 you know? So then, so what the child is doing in some ways determines to some degree what the input is that they get from their caregiver. And so caregivers' expectations can be adjusted down too low for the child, and then the child doesn't get the enriched expectations. And this can happen in very, very subtle ways. But so that I call that a rut. And so what parents might do instead, for example, is start to line up uh, cars next to the child's lined up blocks, right? And then the child will start watching what the parent's doing. And then the parent might drive a car around and maybe put it on top of the child's lined up blocks. Well, there's a chance that the child might reach over and take another one of the parents' lined up cars and put it on another block. See how this expansion is happening? And so now the parents, instead of just saying block, 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 they're saying car. You put the car on the block. Next thing they can do is push the car on the block. Next thing they do, they might stack up the blocks and make like a tunnel for the cars to go through or a bridge for the cars to go over. So this is what I'm talking about in terms of uh, starting to enrich how you're thinking about what your child can do and raise your expectations without causing frustration in children.
Yeah, thank you for that. That made a lot of sense. Um, and based on your findings, what policy changes do you believe are necessary to improve support for individuals with autism and their families?
Okay, I know we're talking about early life here today, but in our center, we see many individuals into adulthood. And one of the things that's a real problem in the United States is really the care for high support needs autistic individuals. We need, I don't know whether you can legislate this with a policy, but we need better training of physicians while they're in medical school and in their fellowships in neurodiversity and neurodivergence. So that's one thing, but not just physicians. Also, we need to build current information about autism into early childhood education, special education, um, general education, because autism is 1 in 36 children, as you know, and so there are going to be autistic kids. Every teacher is going to have them. I really, really would love to see changes in how we're training parents uh, when they have a baby, you know, giving them information about development and what to expect. And at every well child visit, to give parents information about what to expect and give them resources of where they can go and see videos about what development is supposed to look at this child's age. So, I mean, those are some of the key things that are on my mind, for example.
I definitely think that's something that's, you know, been a problem, especially in terms of like learning about autism in school and things like that. But I think that's something that's getting better, and I hope it'll like keep getting better. For example, like I was talking um to this one of my friend's little brothers, and like they don't even like how we say special ed classes like sometimes, right? Like he says, oh, like those are he doesn't even know like what special ed classes are. Like they just know what neurodiversity is now in like elementary school. And like, that's definitely a big shift from like when I was in elementary school. So that's like,
Yeah.
I guess, one positive change that I've been seeing a lot, which is great.
These are great changes. And another big policy thing is really to fund early intervention at a better rate because it's inadequately funded now. And also funding better for childcare because in childcare, parents of autistic children have to work. And so having trained childcare providers and childcare providers who make a livable wage so that they can stay in the profession. Those are some changes I'd like to see.
Really interesting thing that you said because of like how like, applicable I think this is to like, every parent, like, not just if they have a child who has autism, but like, those kind of resources where they can see what normal development looks like, and just know where their child's at. Like, um, I think that's something that would be like, that is so helpful, for like, so many parents and, for the parents aren't, who like don't know about those resources or don't know where to access them, like, how can they get them? And, you know, yeah.
Well, the Centers for Disease Control have free downloadable materials about child development. One of the things that parents have to kind of do, in addition to looking at the CDC website on these things, they should also check in with, for example, the American Speech Language Hearing Association. It's called ASHA. If they Google ASHA communication milestones or ASHA social development milestones, they're very excellent and they lay out for parents what to expect from birth into or later childhood for communication, social, and even for the CDC motor and cognitive things.
How important would you say like collaboration between different fields is in addressing the needs of individuals with autism?
Well, autism is a multi-system condition. And so, yes, there's differences in brain development, but the body is a system. And so we all need to be working together and learning from each other because let's just say that you're an occupational therapist and you start to see a child not being able to do things with their hands that they've been able to do. That child might be showing signs of regression that could have a metabolic basis. And some metabolic conditions are treatable if they're treated early. So that's why, they need to know what things that they need to be contacting a neurologist about or a developmental pediatrician. And developmental pediatricians need to be working with speech pathologists and occupational therapists and social workers, and even GI docs and stuff because we just need to be able to make referrals without waiting. And whether we like it or not, every health care field has a waiting list. And so we just want to be preemptive and get kids on waiting lists. Names can always be taken off of waiting lists if parents change their mind or it becomes a non-issue. But the knowledge that we have across fields is relevant across fields.
Is there any advice we would like to give to new professionals entering the field of autism research or treatment?
Yeah. Number one, uh, learning is lifelong. You'll never have all the answers. So that it's important to stay in the literature, whether you're a practitioner or a researcher. There's lots of systematic reviews and things that are like clinical tutorials. It's important to read them. It's also important to read the literature beyond your own profession. Just relating back to what we were just talking about integrating knowledge across fields. One of the most important things is to learn from families. Uh, no two families are the same. No two autistic individuals are the same. And if you stay humble and you ask questions and you integrate parent suggestions lots of times, the outcomes are better and you become a much stronger professional and researcher. Those are some of my recommendations.
Thank you so much. Dr. Landa, I wanted to extend my heartfelt thanks for taking the time to speak with me. Your insights into autism research, early intervention, and all these things were really enlightening, and I really appreciate you sharing your experience and your expertise. And like that, the work you do is really impactful and inspiring, and like you know, throughout this interview, I could really feel your commitment for improving the lives of individuals with autism. So thank you for this opportunity to learn from you.
My pleasure.